For many people suffering from advanced breast cancer, there is a powerful resource to help with the emotional and physical pain and discomfort, but one that is often not used because of misconceptions by both patients and doctors. That resource is palliative care. When Rhonda Rakowski was diagnosed with breast cancer back in 2009, she was angry.
Well, I was angry that my life was on hold. I just wanted the life that I thought I deserved to have, that I worked very hard to get.
We're just going to start your fluids.
Okay.
After treatment, she thought she may have dodged a bullet, but 6 years later, the cancer returned.
You have stage 4 metastatic inflammatory breast cancer. And I'm thinking, okay, well, that's the worst thing I've ever heard. Oh yeah, and incurable.
The hardest part at the time, telling her family, especially her younger brother, Michael.
I don't remember much about the words, but just the look on her face made me think it was, serious. And she looked kind of hopeless. I'd never seen her like that.
Rhonda didn't want the cancer to control her life, control her emotions. Didn't want to push away those closest to her.
Is it good?
But the pain and the depression was getting the best of her.
I was sitting on that couch. Nobody was around, and I just cried. I was in so much pain. And, I was thinking, am I going to live like this?
That's when her oncologist recommended palliative care, something her friends didn't quite understand.
They said it was the stage before hospice. And I'm like, yeah. Wow, that's kind of scary.
The misconception comes in many flavors. I've been called the angel of death or the grim reaper.
The biggest misconception is that palliative care is hospice care or end-of-life care. And hospice care is one component of palliative care, but I think about palliative care sort of as an umbrella of pain and symptom management, improvement of quality of life, psychosocial support for patients and their families who are facing chronic illnesses.
Most advanced cancer care focuses on clinical and drug-based therapies, but palliative care considers the entire well-being of the patient.
We function as an extra layer of support for our patients who are going through really very challenging diseases and transitions in their lives.
Dr. Halporn worked with Rhonda to adjust her medication and help manage her symptoms.
So if you notice that it's too painful as you go down, call us.
Okay.
We'll probably hold it there. She continued to discover little things like that made a difference. And those kind of things really changed her perspective. I'm not in pain every day, every moment. I can look forward to comfort in the future.
Palliative care doctors offer psychological guidance to help patients like Rhonda cope with the emotional toll of the disease.
I think framing that, you got through a really tough thing and you're doing pretty well. Now we're going to define the areas we have to watch carefully to see how they do. And we talked about what are the options to make this feel better.
Recent studies show that palliative care not only helps patients' quality of life, but remarkably can actually extend life.
When we talk about palliative care, we used to think it was just really a quality of life issue, making you feel better physically and mentally. But what we know today is that when palliative care is part of the early treatment regimen, it actually improves survival.
A palliative care team really becomes a patient and family advocate, helping to navigate the process from the time of a diagnosis through treatment and into survivorship.
Today, it's been over a year and a half since Rhonda's diagnosis, and Rhonda refuses to be told her prognosis. Rather than know an estimate of months and years ahead of her, she's focusing on the victory of each day, being alive and enjoying the things she couldn't do before, like picking up her granddaughter.
Yes, she is. I have a pretty pain-free life right now. I don't have those moments anymore, or those thoughts of, ugh, I can't do this, or how is this pain going to go away, or how am I going to be independent again, and, you know, all those negative things. And you can't be negative when you're trying to fight cancer, that's for sure. Living your life is, you know, what's helping me get better.